3 points are left. Now see here, everyone. C5, C6, C7, C8, T1. 5 and 6 join together forming the superior trunk. Superior trunk will divide into two divisions, anterior division and posterior division. C7 will go and form the medial trunk. C8 and T1, it will join together forming the lower trunk. Anterior division, posterior division, anterior division, posterior division. अब मैं आगे chords नहीं बना रहा. You already know. Now why I am again drawing this diagram? See here, everyone. Here, यहाँ पे आपकी nerve है. One nerve is going upward, one nerve is going downward. This is 1, this is 2. So what is your nerve number 1? Nerve number 1, it is your suprascapular nerve. Suprascapular nerve. अब उसका नाम ही suprascapular nerve है. So it is innervating your which muscle? Supraspinatus muscle and infraspinatus muscle. Second nerve is your which one? Nerve to subclavius. तो उसका नाम ही nerve to subclavius है. It means it is innervating your what? It is innervating your subclavius muscle. Okay. So see here. From middle trunk, no branch. From lower trunk, no nerves, no branches. Only from the superior trunk, you have two nerves. Okay. Suprascapular nerve and nerve to subclavius. Okay. Clear to everyone? अब ये देखिए. From C5 root value, one nerve is going upward like this. This is your dorsal scapular nerve. Dorsal scapular nerve. And this dorsal scapular nerve, it is innervating your which muscles? Rhomboid major, rhomboid minor, and last one is your which one? Levator scapula muscle. Okay? Levator scapula muscle. This is coming out from the roots. You have roots से branches हैं. So from the roots, this is from the branches from the superior trunk. Now from the roots, one branch which is coming out, that is your dorsal scapular nerve. Second branch which is coming out from the roots, see here everyone. It is coming out from the C5, C6 and C7. And this is known as your what? Long thoracic nerve. Long thoracic nerve. Okay. And this long thoracic nerve, it is innervating your which muscle? Serratus anterior muscle. Okay. Which muscle? Serratus anterior muscle. And this serratus anterior muscle, if it is going to damage, patient will develop what? Winging of scapula. Winging of scapula. Very important MCQ. Now see here. This point where your 1, 2, 3, 4, 5 and 6 nerves. C5 root value, C6 root value, suprascapular nerve, nerve to subclavius, anterior division, posterior division. These 6 roots where these 6 nerves which are यहाँ पे है, इनको कहते हैं, this is known as Arab's point. Okay. And if it is going to damage, patient develops Arab's palsy. And this Arab's palsy, patient will develop what? Policeman tip deformity. Okay. Patient will develop what? Policeman tip deformity. And it is your upper trunk injury. Upper trunk injury. If the injury is here, lower part here. So this is known as what? This is your Klumpke's paralysis. Klumpke's palsy. Okay. Root, it is your what? Lower trunk injury. Lower trunk means what? It is going to have the root value of C8 and T1. So patient will develop what? देखो अब इसकी root values हैं C8 T1. So it is going to innervate the muscles of the hand. ठीक है, ये proximal है, ये distal है. तो ये तो आपके ऊपर muscles of shoulder, elbow वहां को damage करेगी. That's why patient develops policeman tip deformity. But here, because it is the lower part of the brachial plexus is damaged, so it is going to damage the muscles of the hands, interosseous muscles, lumbrical muscles. So patient will develop what? Claw hand. Claw hand deformity. So claw hand deformity, it is seen with Klumpke's palsy. Okay, it is seen with Klumpke's palsy. Okay. So this is your Klumpke's palsy. This is your lower trunk injury. This is your Arab's point, Arab's palsy. Upper trunk injury. Policeman tip deformity, claw hand deformity. Long thoracic nerve damage. Serratus anterior nerve will be damaged. Patient will develop winging of scapula. Okay. So this is your whole topic of brachial plexus and their clinical correlation. I hope it is clear to all of you.